It's looking increasingly unlikely that NHS England will make the £22 billion of efficiency savings that it's committed to by 2020. The target was set in the NHS 5-year forward view published in 2014. At the same time, the health service must meet the soaring demands of an ageing population, dramatically increase mental health services and reduce waiting times. Well, one way to work more effectively is to partner with private companies. I'm joined today by Richard Bradford, Chief Executive of the diagnostics and healthcare solutions provider InHealth. I'm Sarah Lockett. Welcome to the Business Debate. Richard, welcome to the London Stock Exchange studios.
Thanks, good to be here, Sarah.
Now, private sector provision of healthcare services has always been controversial. Some people think it's privatising the NHS by the back door. Why should we not be worried?
I'm a huge believer in the NHS. We are a small part of the delivery system within healthcare in the UK. As many people know, it faces huge challenges, as does the rest of the world in healthcare. I think from a delivery point of view, irrespective of politics, it's about looking at the set of services and seeing who can best deliver each of those services. The NHS will require some support in the challenges that it faces going forward. And I think some independent sector providers like InHealth should be part of that answer.
Now, it's been said that there needs to be a change of leadership and culture to fully integrate public and private sector provision in healthcare. Now, how's that going to be achieved?
I think the ideology of NHS versus private sector is a political thing rather than looking at an industry called healthcare. And some people don't like that term, to call it an industry. But actually using that parallel, one could look at other great brands. So I use the NHS as a great brand, but look across at Apple or Toyota. They have long-term partners who work with them, who support the brand for the good of that brand. So they are the front leading brand. And I think the NHS, in terms of its culture, people and organisation, needs to work with organisations like InHealth for parts of that service to support the overall brand.
And it is a question of capacity, isn't it? Because demand is ever rising and the NHS is, by its own admission, struggling.
It is indeed, yeah. So capacity absolutely is being driven by a whole range of factors. The challenges that we can provide extra capacity. I think we can provide also capital. There's also a big shortage of money within the NHS. And I think more than that, we can provide a contribution. We can work successfully to partner with the NHS to help them succeed in some of their challenges that they're facing.
So you mentioned capital. What are the main advantages of the services that you provide, mainly MRI and diagnostic services, being provided by a private company?
I think it's what we do, and therefore we should be good at it. We concentrate on it. We have a workforce that are dedicated to it, that feel special. They're front and centre stage in what they do. They're not just part of an overall system. And we're a cog in the wheel of the NHS, a small cog providing our set of services, all to support the NHS in its goals.
Now, how is it that you're able to do more scans in a day with the same equipment and mainly the same trained staff as NHS staff working in MRA?
More flexibility, I think. We're able to roster and schedule those people across 7 days, which is what the NHS is fighting towards at the moment. We can add additionality of workforce and more flexibility of that workforce. We apply processes to everything that we do, and we're able to share best practice. But I think crucially, Sarah, I think from an efficiency point of view, we are good at what we do because it is what we do. It's the one thing that we do around diagnostics and healthcare solutions, and we can work through that and multiply it several times over.
Now, you're obviously a business and you need to make money, yet you say that you are saving the NHS substantial amounts of money. How do you work that out?
Through efficiency. If you do something enough times and you concentrate on it, then you ought to be better at it. We can prove that in many cases we're 30% more efficient than an NHS alone service. But again, I would expect us to be, Sarah. We concentrate on it every day. Our staff are focused upon it, and we are as a management focused on our particular areas of service. It's a small cog in a big wheel.
Now, you're not just knocking out scan images, you also handle, say, the booking process of the appointments, you also report on the images that are generated. Why is that whole sort of end-to-end service important?
Because I think the service set off as the provision of capital, I think is emerging much more now towards what contribution can we make. And if you look at a patient and the patient pathway from the GP right through to how that patient gets diagnosed, what test, scan or examination gets carried out, it's easier to plan that in a proactive way if you can have access to the whole referral piece. You can then also save costs through that as well. So you can make it better for patients, better for commissioners, actually better for the whole system by managing the referral through to the report or the output.
Well, Richard Bradford from InHealth, thank you very much.
Thank you, Sarah.